Hello, Dr. Mike. Welcome to the Unfiltered Healing Podcast.
Thanks for having me on, Rachel. My pleasure.
How do you pronounce your last name? Because I didn't want to butcher it.
Take a guess.
Belkowski.
Belkowski. You nailed it.
All right, cool.
For some
I'm
reason, the
not.
telemarketers always forget the K and they just say Belowski. So you nailed it.
Awesome. I typically will butcher names, so I always want to ask before I do that. Well, it's a pleasure to have you on today. I'm excited to chat all about light therapy, the benefits of light therapy, why so many of us are deficient in actual illumination of light. So this is going to be fun today to converse with you. What I like to do at the beginning of my podcast is kind of just let my listeners in on a little bit of the speaker. So if you wouldn't mind just talking a little bit about yourself, where are you at? I know you're a CEO of a red light company and product company. And then just kind of what got you into this field of health. Is this something that you were interested in for a while, or is this something that you kind of fell into? Why don't you give the listeners a little bit of info about yourself?
Sure. So I'm a physical therapist by trade. I graduated from the University of Montana in 2016. I was born and raised in Missoula, Montana, which is where that university is. And I still live in Western Montana. So anyway, graduated 2016 and shortly thereafter took a job at a local outpatient clinic, outpatient orthopedics, and it didn't take but a handful of months before I was quite disgruntled with how I was being utilized, but mostly how the quote unquote system is set up, meaning the way insurances dictate how you treat. And this isn't just physical therapy. This is rampant in all of allopathic medicine in the United States, especially. The point being, as a clinic owner, you want as much money reimbursed as I'm not a clinic owner, but my boss, from her perspective, you want as much money reimbursed as possible. Meaning, if there's a treatment that may reimburse more, even though another treatment may be more effective, and being more effective also isn't good because that means you discharge a patient quicker, which means less foot traffic, theoretically.
Mhm, mhm,
Then you're kind of pushed to do this treatment that gets reimbursed more because then obviously the clinic makes more money and clinics run on money. And so that was just part of the puzzle that left me really disgruntled because I knew I could treat my other patients a certain way or with other treatment modalities, get them better quicker. But again, it doesn't get reimbursed more or reimbursed at all sometimes. And so that forced my hand to start my own outpatient clinic, which was cash based, meaning insurances couldn't dictate how I treated. I could treat how I wanted to as long as it was efficacious with under the scope of the state practice and all that good stuff, um, which allowed me to do things like which would be considered holistic and alternative, especially in the physical therapy realm. But my expertise really is dry needling, which is huge for reducing pain. But then I also picked up treatments like um, uh, cupping, blood flow restriction training, most recently hyperbaric oxygen therapy. And then, of course, it was along these, and this is over the course of a couple of years, but it was along learning about these um, holistic treatments that I came upon red light therapy, which I'd heard of before from various podcasts and whatnot, but I didn't really think much of it because it's like, it's light and it's red. It's like, what could this possibly do? But
sure.
I read a lot of books. Amazon suggests and recommends a lot of books, and one of them popped up that was this book on red light therapy. Had a lot of reviews, 5 stars, and I'm like, I'm a sucker for those types of books. So got it, read it, and I was blown away at A, the mechanisms of how red light therapy works, but then B, all the potential ways that it can help heal and mitigate and even prevent diseases. And
Mhm,
the aha moment for me was there were similarities between how dry needling works, which is, again, that's kind of why people come to see me, is for dry needling to get rid of pain. A lot of similarities between dry needling and red light therapy. So with my background in dry needling, and I knew how powerful it was and how effective it was, then I'm like, well, if red light therapy does similar things, plus improving mitochondrial health, which is a whole other topic we can get into, then it's like, wow, more people need to know about this. If it's truly this good, then why don't more people know about it? And so that's when I went to look at what the market had to offer as far as red light therapy. And there were either very expensive devices that it's like you wonder if that really justifies the cost. And then B, you can go get cheap products on Amazon or wherever, and you're probably going to get cheaper results, if you will. And so there
Mhm.
seemed to be this massive gap where someone needed to come in and offer higher quality products for more affordable prices. That's still an investment, but more affordable prices, and more importantly possibly is bring higher level of education to the masses regarding red light therapy. So back in 2019, that's where I founded BioLight, and almost 3 years ago, to the day, I guess, where um, BioLight's seen some pretty good growth, and I think that's just speaks to the interest level in red light therapy more than anything, which is why I'm here today to help educate your audience on the many benefits.
Yeah, yeah. I was first introduced to red light, not really for, the mitochondria stuff, which I know all of that stuff now and we'll talk about, but I don't know if you're familiar with a technique called quantum neurology. It's more specific to like the chiropractic field, which is what I'm in. And that's how I first learned about red light therapy because it was being utilized for basically like retraining the nervous system and rehabbing the nervous system. So I incorporated that like about 6 years ago into my practice, but then I didn't really know a lot of the other facets of red light until I started learning about it, like yourself as well. And it's so amazing for so many different things. And really, our generation, or not generation, our population, excuse me, is so deficient in illumination. So, specifically, can you explain the difference of the different lights? So, near infrared, far infrared. Can you explain those a little bit to the audience so they understand the difference of those and why it's important?
Yeah, so just some background knowledge on full spectrum sunlight. Over 40% of the light that makes it to Earth is infrared in some nature. And within infrared, which is invisible, we can't see it with the human eye, there's near infrared, there's mid infrared, and there's far infrared. And as it relates to red light therapy, only near infrared is what we're talking about, because red light therapy encompasses both red, which is the visible red light, and then near infrared. Whereas infrared saunas use
Mhm.
predominantly mid infrared and far infrared. And those two sets of spectra or wavelengths of light offer very different benefits. They're not the same thing. And that's a question I get a lot is, I'm looking to invest in my health. What should I get, an infrared sauna or red light therapy? And
Yeah.
it's apples or oranges. In a perfect world, you can get both. Ultimately, it depends on what your health goals are, what you're trying to accomplish, but they're completely different. So getting both on a consistent basis is the best. But um, as it relates to red light therapy, that red visible light only treats the skin. It doesn't go any deeper. And so if you're
Mhm.
treating just anti-aging skin or wound healing, you want to use red light. And also just for the visual processes, there's a lot of physiological mechanisms that happen when you take in certain wavelengths of light, so it's good for your eye too. But then also near infrared treats everything deeper than the skin surface because it's a longer wavelength. It travels a little deeper into the body, which is why mid and far infrared, which is longer than near infrared, is amazing for detox, and that's why it's used for saunas, is because
Mhm.
it penetrates deeply. You get the detox, the sweating, the cardiovascular benefits. But again, mid and far infrared does not uh, specifically target or excite the mitochondria, whereas red and near infrared does. And the mitochondria are important, and that's an important um, a difference to make between the two because the mitochondria produce about 95% of all of the energy in our body. And the more energy you have per cell, the healthier you're going to be. And another way to put that is the less energy you have per cell, the more disease you are going to have. And that's been proven by Dr. Doug Wallace, he was the top mitochondrial researcher in the world. So back to your point at hand here, we live in a world where in modern society we're indoors exponentially more than our ancestors, and we're outside exponentially less. And that alone, and that's termed malillumination, that alone is a major cause for this epic rise in modern diseases, from obesity to metabolic diseases to type 2 diabetes to all these neurodegenerative diseases. People like to tie it on being sedentary and diet. And while that does play a role, people don't have an appreciation for what the role of the light environment plays, or the lack of light. Because if you think about it from an evolutionary perspective, our cells, our body, our ancestors were brought up in full spectrum sunlight, yet we're depriving our bodies from that. And uh, the sun is actually demonized, so it's seen as a bad thing. So it's been completely flipped in our heads that sun exposure is good and healthy, and instead we're supposed to be either inside or covering ourselves up with sunglasses and hats and toxic sunscreens and all that good stuff. So um, we've kind of swung the pendulum too far to the other side, and I'm hoping between education with podcasts like you're doing here, um, and I think slowly but surely we're getting back, swinging the pendulum back to the other side of where being out in nature as seen as a very healing modality for physical and mental health.
Yeah, I just tell people, just like any nutrient in your body, light has to be part of our nutrients.
Hmm.
It has to be something that we utilize every single day. And I know it's definitely harder in states where, like Montana or other states where they don't have the sunlight, a good amount of the year. We're pretty lucky here in California. So why we talk about, using specific more red light and infrared products is to be able to still have some of those benefits in these more winter months where we're not exposed to having those different things. Um, what are some of like so let's go into the mitochondria a little bit deeper, because
Hmm.
I know a lot about the mitochondria too from a genetic perspective. And the mitochondria is super, super sensitive to most anything because it's very sensitive to damage in its DNA structure. What is it that the light specifically does to help the mitochondria?
Um, yeah, that's a pretty large question. In essence, what red and near infrared light does is, well, light in general, even full spectrum light, it's giving your body what we would call free electrons. And free electrons are important because the more electrons you can take into your body, the more electrons that can be run through the electron transport chain inside of the mitochondria. And you need
Mhm,
electrons to produce ATP and water. And water is a whole different topic for
mhm,
health.
mhm,
But again, the more electrons you can take in, uh, and another way to say that is the more you can increase your redox potential, which is your body's charge, and hopefully it's a negative charge because electrons are negative. So the more negatively charged you are, the less inflammation you're going to have, because the more protons you have, the more acidic you're going to be. Whereas the more electrons you have, that electron proton balance, the more alkaline you're going to be. And inflammation is acidic. So again, the more
mhm,
alkaline you can be, the more electrons you can have, the greater your redox potential is, meaning the more net negative charge your body has, the healthier you're going to be. And again, back to the mitochondria and light. Light is one form of bringing in free electrons to run through the electron transport chain to produce ATP. The less electrons you have, because you're not getting free electrons from light, water, grounding from the earth, negative ions from walking along the ocean. The less electrons you have, the less potential your mitochondria have to produce energy. So, in essence, in a very basic sense, light is bringing electrons into your body to function on a normal homeostatic level. But red and near infrared light, specifically on the mitochondria, um, further facilitates this process by disassociating nitric oxide from the cytochrome C oxidase. And this is getting kind of sciencey and geeky, but
It's
when
okay, I
there
love
is
it.
But when you're mal-illuminated, this nitric oxide stays bound to the cytochrome C oxidase, and that's
Mm,
bad for 2 reasons. A, nitric oxide is a vasodilator. It allows blood flow to, happen more efficiently 'cause your vessels are dilated, and so if that's not happening, if you're not getting nitric oxide into your blood, then they're not as dilated. Secondly, I learned this, recently with, one of my guests on my podcast, Carrie Bennett, who's just a quantum physics expert. For every two molecules of nitric oxide you produce one molecule of deuterium depleted water. And again, that's a topic for another day, deuterium depleted water and what that means for your body. But that's a good thing. So again, if
sure.
you're malilluminated, not enough nitric oxide dissociation, thus oxygen is not getting into the electron transport chain to allow for that efficient ATP production. So, if you're
Mm,
not getting outside, you're not getting that natural red and near infrared light, then again, your mitochondria aren't operating as efficiently and eventually can become what's called dysfunctional if that happens for too long. And back to Dr. Doug Wallace, the mitochondrial expert, um, it all comes back to the energy production in the cell. And the more dysfunctional mitochondria you have, the less energy you have per cell. And again, the more disease state you have per cell. And cells make up tissues, tissues make up organs, organs make up systems. So if you reverse engineer that, the systems to the organs to the tissues to the cells, well, the next level deeper is the mitochondria. So the
mhm,
root cause for a majority of modern day diseases is directly tied to dysfunctional mitochondria. So again,
yep.
the more functional you can keep your mitochondria, the healthier they are. Ultimately, uh, the healthier you're going to be for a longer period of time. So you're going to increase your health span, not just your lifespan. And so again, back to the point at hand, red and near infrared light is a major catalyst for improving the health and wellness of your mitochondria.
Yeah, mitochondrial health is a huge topic, and it's definitely vital because, like I said, they're so sensitive to any changes. And a lot of people will focus on the nutrients needed for the mitochondria, which I recommend too. But this is important because they need that activation from the light as well for the mitochondria to be utilized. And I'll talk about with you different things that this therapy can be utilized for in just a second. But also, this came to mind when you were talking about nitric oxide, because nitric oxide as well, you know, a deficiency there can also be found in so many different health conditions. And for myself personally, the past couple of years with all of the I don't even want to say the name things that happened the past couple of years, people were getting very deficient in nitric oxide, and I started looking at some of the research with these viruses, and all of the coronaviruses basically are very sensitive to UV and temperature. And so when I started looking into that, I was like, oh wow, well, people are like now crammed in their homes and they're not really in light. And so that's making any type of these things activate. And then they're also not being around people. They're not being outside. And so I think we saw just a huge epidemic in that as well, which was such a tragedy for people, and why we're emphasizing, you know, this affects so many different parts of your life and so many different parts of yourself. So I don't know if you noticed anything or correlated anything with that yourself as well.
As far as the pandemic and the implications of that on health,
Yeah, well, just as far as like you know, what we talked about initially with people being inside so much and even more so the past couple of years, and how that affected people's health as well, not only isolation but not getting light, not getting outside, not being out in the world.
sure. I mean, that just exacerbated um, any symptoms. And if you didn't have symptoms before, that surely didn't help the cause. I mean, there's just a litany of research on the health benefits of UV light, again, which has been demonized, let alone full spectrum sunlight. And like you're saying, people not getting out in nature, getting that nature bathing, which decreases stress, increases serotonin and dopamine. And then, like you're saying, the human to human connection, being isolated, what happens to mental health there. So yeah, it was a recipe for um, disaster, really, on a from a health perspective.
Mhm.
outside of the virus itself. Like you're saying, it was just exacerbated by being further isolated from people and nature and the sun.
Yeah. Yeah, I just thought it was interesting when you were talking about nitric oxide because that's when I was testing people for that during that season, they were all deficient in nitric oxide, so it's interesting.
Well,
Um,
an interesting point about nitric oxide as well.
yeah.
When I interviewed Patrick McGowan, who's considered, the top one of the top breathing experts in the world, um, and from the book by James Nestor that's called Breath, you
Mhm.
can significantly increase your nitric oxide production via nasal breathing because
Yep.
the vast majority of people breathe through their mouth. And I was one of those before I read the book and interviewed Patrick. And that's just one of the many benefits of breathing through your nose is a massive increase in nitric oxide production. And again, from what I learned last week, for every 2 molecules of nitric oxide, you get 1 molecule of deuterium depleted water, which is huge for your body.
Yeah, nasal breathing's huge. I'm a big proponent of that because 'cause I'm a craniopath, so work with
Mm-hmm.
I've read that book, I work with all the airway specialists, so yes, I'm excited that you know that already, that's great, that you know that component. So, um, going back to hydration for water, because I don't think I knew this aspect of what you were saying as far as, the deficiency in the mitochondria or maybe the deficiency in electrons from lack of illumination makes you dehydrated. So can you dig into that for a minute?
Well, sure. That simply just goes back to the concept of the less electrons you have running through your body, the
Mhm,
less potential you have for everything getting through the electron transport chain, with the last two steps being water production and ATP production. And
mhm,
so, I mean, that even brings up a whole other rabbit hole we can go down as far as the implications of the electron transport chain. There's 5 steps. You need electrons to jump from 1 to 2, 2 to 3, 3 to 4, 4 to 5 in order to produce water and ATP for energy. And
mhm.
there's ways to shrink the distance, and that's important because the less distance there is for the electrons to jump or travel, the more efficiently they're going to make it through, the less potential there is for them to uh, more or less spill out between 1 and 2, 2 and 3, 3 and 4. And that's another reason why you want as many electrons as possible, is so that there's less spilling out and more make it through. But the
Mhm.
ways that those they're called respiratory proteins, the one, two, three, four, five. The ways that the respiratory proteins can get stretched out is through too much exposure to non-native blue light. So think about all of the technology and lights we're surrounded by, fluorescent lights. If you're an office worker or even at home, and then all the blue lit technology from cell phones to tablets to computers to TVs and so on and so forth. And so being exposed to that non-native blue light is toxic for the mitochondria and is one of the main factors for stretching the respiratory proteins. And that
Mm.
alone is a reason why people have issues with water production, meaning they're dehydrated, and then energy production, which is um, massively harmful if we look
Yeah.
at it from a mitochondrial perspective. And so there's non-native blue light, but then there's also this non-native EMFs such as Bluetooth and Wi-Fi. And now we have 5G. That's another way that our respiratory proteins can get stretched, and we have the same issues.
Yeah.
So not only are we inside far too often and not getting enough real light, but we're now doing the double whammy by being surrounded by non-native blue light, non-native EMFs, which just further exacerbates the issues of not getting enough light. So if you're able to reverse those two processes, of course, we're probably never going to be able to eliminate this Bluetooth Wi-Fi world that we live in. But if you can mitigate it, I mean, there's techniques you can do, or limit your time, but reversing that where you're not exposed as much and then getting out in nature more, I mean, that alone can do loads of good for your health and wellness and mitochondrial health. But back to the point, or the main question you had, those two things also affect your body's ability to be hydrated because, again, you need electrons to get through to step 4. I believe it is step 4 for water production, which is that biological water, fourth phase of water, easy water. Um,
Mhm.
that essentially is a major source of energy for your body as well. So again, if you're not getting electrons from the sun, if you're not grounding, if you're not drinking electron rich water or something structured water, then um, then you're not going to have, or your body's going to be dehydrated. And dehydration is one of the main signs that your environment isn't right. Like you alluded to, the mitochondrial are environmental sensors. And if you're
Mhm.
dehydrated, that's a sign that your mitochondria aren't producing enough water. And there's, like I just talked about, now there's a myriad of reasons why that could be.
Yeah, that's super fascinating. Thank you for explaining that. So,
Yeah.
as we know, mitochondrial dysfunction has a whole myriad list of diseases, diagnosis, and things of that nature. What's some of like the most recent maybe research you found or information you found related to photo modulation or light therapy modulation? So, what are the kind of main things that you've been researching lately or have researched already for the health benefits?
Yeah, so for photobiomodulation, there's been a massive uprise, or not uprise, but exponential interest in the research in the past 10 years, especially the past 20 years. It's gone from hundreds of studies a year to thousands and thousands of studies per year. So some of the most recent stuff that's interesting and pretty profound is as it relates to brain health and gut health, I would say are the big two, and eye health as well. And if we step back for a moment, and again, we're talking about red light therapy, and red light therapy helps improve or optimize the health of the mitochondria,
Mm-hmm.
and mitochondria have to do with energy production, then it makes sense that the most energy intensive organs should respond positively to red light therapy. So, what organs require the most energy? Well, the brain for sure, by far the most mitochondrial dense.
Mm-hmm.
With that being said, that's a double edged sword because if you're someone who's um, living in this modern day world where you're not getting enough sunshine and you're inside too much, the first organ, um, or let's say this another way, um, the first organ that's going to be uh, negatively affected by mitochondrial dysfunction is going to be the one that has the most mitochondria, and that's the brain. And so
Yeah.
there's no surprise, and it's no coincidence that we've seen this massive increase in neurodegenerative diseases and Parkinson's and Alzheimer's and dementia, let alone depression, anxiety, and stress. The brain is hugely impacted when it comes to mitochondrial dysfunction. And so there's that, and then the heart and the liver and skeletal muscle are the other ones that are very mitochondrial dense, along with the eye. And so it makes sense that those organs and tissues should, in theory, be able to see a lot of benefits if red light therapy is utilized correctly. And so some of the research that's come out recently has to do with transcranial photobiomodulation, where you're doing light through your skull directly to the brain. And there's a lot of interesting research. One I just did actually for my solo sode for this week's episode on my podcast that has to do with post concussive symptoms, which is pretty cool because concussions,
Mm-hmm.
especially in sports or war combat and otherwise, is pretty huge.
Mm-hmm.
And uh, it was only a case study, but seeing how red light therapy was used, and it was kind of like this cap that you put on your head, and there's near infrared lights all
Yep.
around the inside of the cap, so it gets through your skull into your brain, and you can see some
Mm-hmm.
really cool results by reducing inflammation, improving circulation, and of course, optimizing the health of the mitochondria in the brain. Um, but along with that, looking into gut health, not only in the past couple of years has the photobiomodulation research shown improvements in the gut microbiome, which is huge because there's systemic benefits from that. As Hippocrates said, all disease starts in the gut. So if you can improve your gut health, improve your gut microbiome, there's a lot of good that can come from that for your whole body. But there's the gut brain axis. So not only can you improve your gut health directly, but there's been a couple pieces of research that look at altering um, different parameters in the brain for people that have Parkinson's disease or that have Alzheimer's or that have depression. And they don't do red light therapy specifically or directly to the brain. They do it to the gut and see positive results up in the head or up in the brain. So I think that's really fascinating. Um, and again, I think it's just the tip of the iceberg for where red light therapy is headed. And as far as it relates to brain health and gut health, but the
Yeah.
third one
Just
was
to, just to
heart
stop
health.
just to stop you for a minute, I'm gonna intervene. Um,
Yeah.
yeah, so the gut brain part, what I use light therapy the most is because I see a lot of concussions and brain injuries,
Mhm.
and that's often times where that, access gets super dysfunctional, and then later on, like a couple of years or months down, now they have all this gut dysfunction happening. So when we go back and we heal the brain and we do light therapy, I do light therapy a lot with my brain injury patients because I'm retraining the cranial nerves. Um, it's hugely impacted for the gut. So how you said using light therapy on the gut can help your brain, absolutely, I see that too, but also using it just on the brain can immensely help your gut because all of your parasympathetic nerves in your brain all control mostly how your gut functions as well. So, I see that a lot too. So it's phenomenal using this type of therapy for so many different things.
Yeah. Yeah. It's basically a Swiss Army knife is the way I kind of explain it to people because if you go down the list of ways that red light therapy can help different aspects of health, it does start to sound like a snake oil pitch. It can help with
Sure.
skin health and thyroid health and eye health and brain health and sleep and athletic performance and women's health and men's health and um, on and on and on, immune system, cancer, even.
Yep.
Anything with inflammation or pain, it's like, what can't this do? And when you understand how and why it works, which we're talking about in this podcast, you're getting at the root cause of all of these diseases or health conditions, and that's the mitochondria ultimately, and or
Yeah.
inflammation. And
Yeah.
so that's how and why red light therapy works. And if people can understand that, I think it makes it more believable that it can help with so many different things. And the best
Yeah.
part is it's non-invasive, it's safe, no contraindications, and much cheaper than if you're looking at doing surgeries or a lifetime of prescription medications or so on and so forth. I mean, and again, when you consider that it's a Swiss Army knife, and you might get a red light therapy device to treat your skin because you want that beautiful anti-aging skin on your face. Well, then you have a headache the next week. You can use it to decrease the headache, or maybe you get stressed. You can use it to decrease your stress, which brings up a good point. My company, BioLight, this past summer in 2021, we did a research study with our own panels with BioStrap. So we used the BioStrap to gather biometrics, and we went into the study more as a sleep study. We wanted to see how biometrics would be affected with full body red light therapy. And ultimately, we got as close to getting statistically significant numbers without getting them. If we would have extended the study another week or two, we would have gotten them. Um, so that to say that red light therapy does help with sleep, but what we did get and we weren't necessarily trying to get was that with every session, with every full body session you do red light therapy, you increase your heart rate variability by about 120%, which is massive because that means every time you step in front of red light therapy, you're automatically decreasing your stress. You're tapping into your parasympathetic nervous system, which in today's society of on the go, 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 stress, 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 always fight or flight, that's massive to have something in your arsenal where you know when you step in front of it, you're going to decrease your stress. And that's not even pairing it with breathing exercises or meditation or otherwise. That's just red light therapy alone. So you can imagine that you can further boost those results with coupling it with something else.
Yeah, I was gonna ask you that if you recommend people do things when they're in the light, because I recommend that. Sometimes if they just need to calm down, I'll throw them in my room with red light and, like, they'll come out a different person.
It's
Which is
true.
great. It's totally true. Oh, they're like, "Man, I feel so relaxed." But other times, if it's some of, like, my brain injury patients or we're doing specific things, I'll have them do, like, different eye exercises or face exercises or tongue exercises because it also, really stimulates the nervous system as well. You know, the brain, like we said, it loves light. The nervous system loves light, and that's
Hmm.
how we retrain the nervous system. So the nervous system can be rehabilitated. We've seen it many times with light therapy. So that's part of it as well. Is you can do, you know, stretching. You can do whatever. Do you recommend certain things for people that use your products as well?
Um, I mean, nothing specific other than what's been shown, let's say in the research, to further improve mitochondrial health or decrease stress if that's what you're going for. So, like we're saying, meditation and or breathing exercises. A lot of people do it in combination when they're doing like yoga or stretching exercises, or if you have like a stationary bike, putting one in front of there. So
Mm,
you're exposing yourself, because the research shows you can significantly increase your fat loss by incorporating red and near infrared light. Um, for mitochondrial health, getting on a vibration plate is huge because
mhm,
mitochondria like that vibration, so you can couple it with that. Uh, People who want like structured water or increasing the electrons in their water, you can fill up your glass of water and put it in front of infrared light, because
mhm.
you can build up the easy water quickest with infrared versus the red light.
Yeah.
Um, I mean, those would be my top ones, off the top of my head.
Yeah, that's super fascinating. Okay, back to the rabbit hole we're gonna get out of. You were then talking about number 3, which was the heart. So go
Oh
back
yeah,
into
yep.
the mitochondria.
So and to backpedal just a little bit more, I've developed a ebook. It's called the Red Light Therapy Treatment Protocols ebook, where um, and I revise it, about twice a year. The first part of the book is information on red light therapy, strategies, things people need to know so they can best utilize and understand red light therapy. And then the other 2/3 of it is protocols and research on various things like thyroid health or skin health or wound healing or mental health. And I've developed these protocols all based on the research. So as research continues to come out, I'll update those protocols and or add to them. um, and my point being, I don't have a protocol for heart health as of yet because there just isn't enough research on
Mm,
heart health. But
mhm,
recently there was a research done on rats with heart failure that showed that red light therapy improved the heart function in various ways. It improved circulation, it improved
mhm.
energy production. They specifically cited increased ATP production in the heart, which makes sense because it's mitochondrial dense, and
Yeah,
it improved the function of the cardiomyocytes. And so, while again it's on animals, um, it's just one piece of research. It's still good to see that there's at least interest in red light therapy and the heart and heart health, uh, because again, it's so mitochondrial dense. It only makes sense that it works. I think the research will just continue to come out, and we'll be able to
yeah,
see the different ways. I mean, that was just heart failure, but how can you use it to um, maybe precondition it in a way, or just use it for prophylactically? Just like I use my small handheld device, I'll use that once a week or so on my gut. I'm not trying to fix anything, but when the research is there and it shows so many benefits, just doing it
yeah,
prophylactically or proactively, um, and I think as the research comes out, we'll see that for the heart as well. That maybe use a specific device maybe once a week or once every 2 weeks on your heart just to make sure it's getting all the energy and light energy it needs to produce optimally. But the point being, uh, we need more research for heart health to get more specific protocols and more specific use cases. But it's cool to see that it's starting to come out now.
yeah, that's super fascinating. I mean, even if people aren't, you know, super okay or interested in more holistic health like we are. I mean, using red light to even just maybe mitigate some of the things that they're doing could also be helpful. I feel like as well, if they do decide to do some of those interventions, then just utilizing this type of therapy to help mitigate some of that can be helpful as well. Um, it's also great for pain relief. You know, a lot of people use it for pain relief in physical, more musculoskeletal things as well. So with all of that being said, is there like a certain necessarily time limit for individuals to use red light and infrared light that you specifically recommend? Can you have too much red light?
Yes, especially to your last question. And I think that's where uh, people try and red light therapy that don't get results. I think that's the pitfall uh, they fall into, and that brings up a good, uh, I guess, principle of red light therapy, which I include in my ebook, is what's called the biphasic dose response, where it's a bell curve, and on the far left of that bell curve, if your dosage is too low, you're not going to get the results or the benefits you're looking for. And on the far right of that bell curve is where I think most people are, because more is better, right? Is where
Yeah.
the dosage is too high. And while nothing bad is going to happen, likely you might get some detox symptoms. You might get some headache or nausea, but even that's pretty rare. Uh, but if your dosage is too high, then again, you're not going to get the results you're looking for. So it's all about getting the dosage underneath that bell curve so that you do get the results you're looking for. And most of the treatments are shorter than people would think. Uh, Thus, most people are over treating. And so your question is a good one, but it's a very kind of a complex question, because the dosage depends on your person, yourself. It's always an n equals one game. One thing doesn't work the exact same way for everyone's biology. So it depends on, your age, your sex, your race, your general health status. I mean, the healthier you are, the less red light therapy you need. The less
Mhm.
healthy you are, probably the more red light therapy you need. It also depends on what you're trying to treat. Are you trying to treat your skin? Are you trying to treat your brain? Are you trying to treat your thyroid? I mean, those are all going to dictate the dosage that you need to have an effective treatment with red light therapy. So again, that's why I developed that ebook, is because I just synthesized the best research in every area. Let's say thyroid health, see what they did to get the most successful results, and then develop a protocol based on that. And the protocol is going to include the distance from the device, because the closer you are, the more energy you're going to get in a certain time. Whereas if you back off, you're going to exponentially lose the amount of energy you're absorbing. So there's distance. There's the
Mm.
type of light you're going to use, because again, red versus near infrared. Sometimes you use both. Sometimes you use one or the other. And then the duration of the treatment, um, based on how many joules of energy you want to absorb for a given condition. And so let's say someone's just going for general health, because I think that's kind of the question you're looking for. Like, how much should people be using red light therapy? And again, it's different from person to person. Is it a kid, teenager, adult, and even animals? Red light therapy is great for pets. In general, 10 minutes most days of the week will probably lead to, positive results for health and wellness. And again, that even depends on the season. And I tell people this all the time. In the wintertime, I'm using red light therapy all the time. In the summertime, almost never, because I'm getting all my light from the sunlight. And so there's even a seasonality to it, unless I'm trying to treat, something specific in the summer, like pain, or maybe I got a wound.
Mm.
Um, but in general, again, about 10 minutes most days of the week, you're going to see some great results, because most people are just mal-illuminated and deficient in the red and near infrared light spectra.
Yeah, I think people are doing a lot longer than that. I
Well,
actually
yeah,
had
and I don't mean to interrupt you, but that was another impetus for me to develop that ebook, is because I saw all these companies or people touting that you need to be doing 20 to 30 minutes every single day. And it's like, holy cow, that's a lot if people understood how many joules of energy they're absorbing relative to what the research is saying you need for positive results. So yeah, that's far too much, unless you're treating the nervous system. Like sometimes the brain, sometimes the spinal cord actually
Mhm.
requires like 30, 45, 60-minute treatments, but that's
Sure.
a rare case. Typically, it takes far less than people would think.
Yeah, I have patients that after they use, like, the mat that I use, they've purchased it for themselves, which is great. But then I've had patients that even though it's not far infrared, 'cause it's not a sauna, it's near infrared, which doesn't penetrate as deep, but it still penetrates, especially if you're using it. And I've had patients that came in and they're like, "Yeah, I was using it for like, a few hours," and they just started dumping heavy metals and
Yep.
felt pretty awful. So we also want to be careful not overdoing it. More is not better. Everybody always thinks more is better, and it's
Mhm.
not. Better is better. So we want to have the best amount of time to get those health benefits, but then not to stress your body out because now you've unloaded all of these toxins into your system. Um, and different. So for your product specifically, are they a combination of red light and infrared? Do you have just red light? Why don't you go into what you provide a little bit?
Yeah, so all of our devices include red, and near infrared. And they have the light settings where you can do just red, just near infrared, or combo.
Yeah.
So I'll just show on this one. But this is the same for even our full body panels, where the first setting is combo, and so half of it looks like it's off, and that's the near infrared because that's invisible. So
Mhm.
then this would be combo. Then this would be all near infrared, and you can see maybe a slight glow.
Mhm.
But this would be all near infrared, and you can even feel the warmth, which makes sense because of the infrared aspect. And then you can do all red. And so again, that's the same with all of our products. So again,
Yeah.
depending on what you're trying to treat, you
I
have
I was
options there.
I
Go
was
ahead.
super interested in your how you talk about it for oral health too. That really was interesting to me because I've never used it in particular for oral health conditions. And you have an actual device that you use and you put inside your mouth. So I thought that was super interesting. What have you seen as far as maybe even anecdotally for people using it for oral health?
A lot of people. So it's back here. And again, so this it's called the Guardian. It's tough to bring up on the camera here, but this incorporates both red and near infrared. And I don't know if there's any other mouth device that incorporates near infrared. Most just have the red, but
Mm-hmm.
incredibly there's incredibly high amounts of research on red light therapy and oral health. You can improve gum health. Anything with an itis, you can help with. Any type of surgery, you can do pre and post to improve the surgery. It can potentially help with enamel erosion, tooth sensitivity. Um, what's another one? Burning mouth syndrome, herpes.
Wow.
I mean, the list goes on and on and on. If you go to the oral health section on the BioLight website, I mean, you can see the laundry list of ways the red light therapy can help with oral health. Another big one, I guess, would be improving the oral microbiome. Just like you can improve the gut microbiome by enhancing the amount of beneficial bacteria, decreasing the amount of harmful bacteria. Same thing for the
Mm-hmm.
oral microbiome.
Mm.
And when I interviewed a holistic dentist, he was actually my first podcast guest, Dr. Kelly Blodgett, who's over in Portland, Oregon. Um, he impressed upon me that the oral your oral health is tied to every single aspect of your body. And one of the big connections he made was your oral microbiome is directly tied or connected with your gut microbiome. And if we
Mhm.
know that the gut microbiome or the gut brain axis can affect your mental health, then you could argue that your oral health can, through your gut microbiome, affect your mental health. I mean, there's all these connections, but needless to say, taking care of your oral health is more important than just taking care for the sake of having, good mouth or oral health or, pretty teeth.
Yeah.
It affects your entire body. And so when I learned that and I saw the massive amount of research on red light therapy or photobiomodulation in oral health, it was like a no-brainer that people need something like this on the market because while you could take a device like this, the Shine, and like open your mouth and shine light
Mhm.
in or just do near infrared through your skin to certain areas, it's a little more cumbersome. It's tougher to gauge how much light you're actually getting there. So to have something that you can literally put in your mouth, and the light irradiance for this is much lower because your gum tissue is sensitive to light. So again, it'll be tougher to gauge using a panel or a handheld device. So hence we came out with the Guardian.
Does that have like a self timer on it?
Correct. Yep. 16 minutes. So
16 minutes.
anywhere between 10 and 16 minutes, given the lower light irradiance, is gonna give you some pretty positive results. And the first time I used it personally, I just felt like my mouth was energized after using it. I mean, it's tough to explain, but it just felt like there was a lot of energy in my mouth after doing that first red light therapy session. And then from
Yeah.
other customers and people that have used it, it's like people that have chronic or easily bleeding gums. It's like very strengthened gums. Their gums are bleeding a lot less, if any at all. People post surgery are reporting like miraculously, accelerated results, or their orthodontists or surgeons are noticing how quickly they're recovering from surgeries. So it's pretty darn cool.
Yeah, I'm definitely gonna go get one of those for myself because I've had a lot of oral stuff this past year, and that was really interesting to me. And also, I see a lot in my practice, a lot of really chronic infection people, and they can hide in the roots of teeth. They can,
Hmm.
hide in those areas, and they're really tough to get out unless that person pulls the tooth or something to that nature, which sometimes is recommended. But I'm excited to have something else to recommend for their oral health, rather than just nutrients and things of that nature to help pull those infections out. So that was interesting to me, and I'm gonna get one of those for myself because that's awesome. Um, so, why don't you tell our listeners a little bit about where they can find some of your products, where they can find more information about yourself? Because I know that you also have a podcast that you do as well, all about the different aspects of light therapy and health, and it's really amazing as well. So, why don't you give a little plug of that for the listeners?
Sure. So, for my company BioLight, the website is biolight.shop. So biolight.shop. So there's products on there, but also there's just a library of information on the different topics we've covered, and then some, whether it's anti-inflammatory, pain, skin, thyroid, so on and so forth. Each page is full of how red light therapy works for that condition or organ or tissue, what the research says. So if people are curious about how red light therapy can work, it's a great source as much as it is to sell products. And
Mhm.
then, like you said, I have my own uh, uh, podcast. It's called The Red Light Report, and it's on all major platforms, Spotify, Apple, and all that. And while it is targeted towards red light therapy and light health in general, I do bring on some of the top experts in just health and wellness and medical and biohacking and anti-aging longevity. So we get some pretty cool people on there as well.
Yeah,
Um, and
it's your
then I guess
ebook. Is your
lastly, all the
is
social is basically biolight.shop. So whether it's Instagram, Facebook, YouTube, you can find us with biolight.shop.
is your ebook on that website too?
Correct. Yep.
Okay, awesome. Yeah. And then I had one more question that I forgot to ask you earlier. So I know that we're mainly focusing on like red light and infrared light, but I do get people that ask me about other types of like colors of light too, like blue light and other light spectrums as well, because I know those have different uses. They're not really for the mitochondria and things of that nature. Um, do you recommend any other light spectrums for people?
Yeah, I would recommend all of them, which would be full spectrum sunlight from the sun,
Sure.
and um, because it incorporates all of those, blue, green,
Yeah.
violet, ultraviolet, yellow, orange, red, infrared, so on. Um, there are benefits to isolating them, such as blue light, not the non-native blue light from screens, but blue
Yeah.
lights from LEDs, such
Yeah.
as uh, devices that would help with antibacterial. So it's really good with acne.
Yeah.
It helps whiten teeth, or it helps with other types of gum health. So actually, stay tuned for BioLight to release something related to that in the near future. I'm not sure when this podcast is going live, but we have something coming out in the next month or so.
Cool.
Um, I'm not extremely savvy with all the different
Sure.
colors. I think I know that yellow and orange may have aspects of anti-inflammatory, or can help with mood. I know um, ophthalmologists or optometrists, some that are holistic, they'll use color to
Mhm.
um, either help with eye health or even mood
Yeah.
disorders. I mean, turquoise is a popular one. Um, Again, I can't speak very intelligently about all the different colors, but I do know that they are all important. But just for the sake of our topic, red and near infrared light is about the mitochondria. But that's not to say orange and yellow and green aren't beneficial. Of course they are.
Yeah. All of the colors. We're meant to live in a colored world.
Yeah, absolutely.
All right. Well, this has been illuminating for a pun on words. Thank you so much for taking the time out of your busy schedule to speak to my audience today. Everybody go to his company, his website, and definitely get yourself some red light therapy. And we will catch you guys all on the next episode. Have a great rest of your day.